Many who are dealing with mental health issues also suffer from other medical problems, from diabetes to COPD and heart disease and many others. The challenge becomes integrating the care for each of these illnesses. Andy Roesgen visited one facility in Nashville tackling that challenge.
For decades, people here in Tennessee have been coming to Centerstone to treat their mental health issues. But what happened when Centerstone realized that people's physical health issues had such a big impact on their mental health? Walk a mile in Ronnie Whitley's shoes and you might be shocked. He still lovingly tends to his mother's grave, decades after he was traumatized by her tragic death on Christmas. Ronnie came to Centerstone to finally get the mental health treatment he needed. But when Centerstone pursued integrated care and made room for primary care doctors in several of its clinics, well, the pieces really fell into place.
I had blood pressure problems, things that I didn't even know was occurring in my body at the time.
Centerstone CEO Vero says the original challenge was breaking down the silos between behavioral physicians and primary care doctors.
And unfortunately, we haven't been very good communicators. We haven't exchanged key information about a person's healthcare status, and just professionally, we've not collaborated and consulted when necessary.
But now, care here is fully integrated. People who come in for behavioral issues can get physical care screenings, and people who come in for physical health care can get a behavioral health care screening. About 70% of those who come in for behavioral health problems also have physical problems, like COPD, diabetes, asthma, and nicotine addiction.
The biggest impact that we can make on healthcare is addressing our behavior, right? I mean, what we choose to eat, what we choose to do, whether we choose to exercise.
To get the integration off the ground, Centerstone brought in a registered nurse and formed a relationship with a primary care practice. They also sought ways to improve care coordination to solve the enormous challenge of keeping straight their patients' complex conditions and medications.
If I had as many appointments that they have, and generally their life is pretty chaotic anyway, but they're also a lot of times really physically sick. They have multiple chronic health conditions. It would be hard for any of us to manage.
And another huge part of the integration was managing all the patient data. Centerstone's Research Institute is now continually crunching the numbers through a platform it created called Enlighten Analytics.
We're really trying to look at all the data that's available and extract the valuable information, throw away the extraneous information, and package it so that it can be useful to people, consumers, clinicians, to provide better care.
Centerstone is getting that data through several high-tech tools as part of its co-action health intervention model. Patients are getting smartphones that contain an app called Ginger.io from its San Francisco tech partner. Through the use of the smartphones, providers can track patients' movements and when they're communicating. It's all with the patient's consent, and it's HIPAA compliant.
If it's normally stationary from, say 11 o'clock to 6 o'clock in the morning and you don't touch it, but all of a sudden at 3 a.m., there's a big flurry of activity, it knows that something has changed. Right now we have a healthcare system that's very crisis-driven. We very much try to clean up the milk after it's already been spilt, and we have to get ahead of that.
Another data collecting tool, Fitbit pedometers for patients, which have been motivating them to get more active and take more steps. And for Ronnie, every step he takes nowadays is a step in the right direction.
And if it hadn't been for Centerstone and the doctors here, it never would happen. And I feel pretty good. I can play with my grandchildren again.
In Nashville, I'm Andy Roesgen.